everyone, welcome back. All right, in today's video, we are going over 3 medications that are super common that could be affecting your GI function. But before we jump in, go ahead and hit the like, subscribe button, share it with a friend, and help us get our content out there, because every single time you hit the like button, YouTube will share our content with somebody else that we may be able to help. So we really appreciate it. All right, without further ado, 3 medications that could be affecting your GI function. All 3 of these medications are really common. A lot of patients are on them, and they're on them for really long periods of time. And even though a couple of them actually should have shorter indications to them, patients still take them a lot. So the first medication we're going to think about is proton pump inhibitors. Things like Protonix, Nexium, Prevacid. All of these medications are designed to shut down stomach acid, right? So it shuts down your production of hydrochloric acid. It's used for things like GERD and heartburn. And a lot of patients are on these medications daily for a long time. So if you are on a medication that you take daily for heartburn, right? It might have one of the generic names, you might not be 100% sure, but if you're on a medication daily that you take for heartburn, it most likely is a proton pump inhibitor. So why do we worry about them? Well, first of all, proton pump inhibitors have a recommended use of less than 90 days. And has a recommended use of less than 90 days because we know that stomach acid is really important for the absorption of a lot of different nutrients, and that proton pump inhibitors can greatly affect your absorption of different nutrients. So it greatly affects your absorption of zinc, vitamin B12, iron. It greatly affects your absorption of a lot of different things. And so we get a little bit concerned about that, right? Sometimes you will see it in patients where their nutrient status will change, especially if they've been on a proton pump inhibitor for a long time. But when we're thinking about GI function, it actually is different, right? So you would think that a proton pump inhibitor would help GI function because you're no longer getting GERD. So yes, it can take away your symptoms, but what a lot of patients don't realize is that heartburn can actually be related to low stomach acid, not necessarily high stomach acid. So sometimes we're not even really treating the problem. On top of that, our stomach acid is there to protect us. Our stomach acid helps us digest our food, and it helps us to keep away intruders, right? So when we're eating food, oftentimes the little kind of like normal bacteria that's on our food, we don't want it to get into our GI tract and populate, because then you can end up with issues. Candida is a really good kind of example of this, right? So if you're eating leftovers, right, that's why patients with Candida often can't do leftovers very well. Sometimes those little kind of normal bacteria that are on your food that you should be able to handle, you can't handle because your stomach acid doesn't kill it off on the way in. So with that, proton pump inhibitors can raise rates of SIBO, which is small intestine bacterial overgrowth, and raise rates of Candida. So if you're having symptoms of diarrhea, bloating, or constipation, proton pump inhibitors could be something to look at in terms of if it's contributing to symptoms of SIBO and Candida. Our second medication is a super common one. It's a doozy. The majority of women have been on this medication or are on this class of medication, and most women have no idea that it's affecting their GI tract. And so this one is oral contraceptives or oral birth control pills. And a lot of you might be thinking, oh my gosh, I've been on oral birth control pills forever. Nobody ever talked to me about this. Well, oral birth control pills affect the GI tract so much that it's actually in the package insert, right? The thing that nobody ever reads. It's right in there. It affects gallbladder function, so it raises rates of stones, but also it changes your gallbladder ejection fraction and can decrease your ejection fraction so that your gallbladder is just not functioning as well as it normally would. So sometimes you can end up with a little bit of difficulty digesting your food, difficulty digesting fats, and pain with eating, especially kind of in this area here by your xiphoid process. And then on top of that, birth control pills also help to raise rates of Candida and SIBO, which we just talked about. So those kind of symptoms of bloating, diarrhea, constipation, those can be affected also by birth control pills. But on top of that, birth control pills also have been shown to raise general GI inflammation and can contribute to things like increasing food intolerances. So patients who have done really well on a variety of foods and then slowly over time their GI tract just seems to be a lot more finicky and seems to be reacting to a lot more things. Oral contraceptives can increase the inflammation, which overall can increase that kind of leaky gut that we hear about, and those food intolerances. So it's definitely something to consider when you think of oral birth control. The third medication is another really common one, and that's NSAIDs. So things like naproxen and ibuprofen, right? And if you think about how commonplace these medications are, right? Like if somebody gets a fever, they automatically reach for some ibuprofen, right? If you sprain your ankle, you automatically reach for some ibuprofen to reduce that inflammation. And in those kind of acute situations, that's great. But there are a lot of patients that are taking NSAIDs daily for pain. And when we think about daily pain and taking that much NSAIDs, we really worry about the lining of the GI tract. So NSAIDs really reduce our lining of our GI tract a lot and can increase our risk for things like GI bleeding and ulcers and just overall gastritis, or kind of like inflammation in the stomach pain, right? If you're having pain every day, then we want to take a different approach. So with pain every day, things like turmeric or curcumin has to be mixed with black pepper for proper absorption. Boswellia can be helpful in reducing inflammation symptoms. And then kind of getting to some of the causes of your inflammation is going to be really important so that we don't have to live on NSAIDs every day. Again, if you have fever, an acute injury that you need to rehab, then anti-inflammatories can be really, really helpful, but every day they're really not a great choice. So tell me in the comments below if you have been on these medications for a long time, or if you ever even heard about any of these symptoms or how these medications could be affecting your GI. And as always, go ahead and hit the like button for us. Hit it again, because we really, really appreciate it. And then, yeah, we will see you next week for our next video.